past year for the health system has been a big one, and it's been a big one for consumers as well. We've had extended lockdowns, we've had the need for continued action on the pandemic, but we've also needed to address business as usual and the long-term reforms we need to see in healthcare. Our Consumer Commission examined that last year, where they looked at the fault lines in our health system exposed by the pandemic, but also the enormous opportunities for change and improvement. As we close out 2021, we've seen two very welcome measures that address some of those opportunities identified by consumers in the community: prevention and telehealth. The National Preventative Health Strategy has been a long time coming. It's wide-ranging and we've really welcomed it. It really signals an opportunity for change. And importantly, I think it sets out the long game for prevention. The elements that we really welcomed in the strategy was the focus on health literacy, the importance of increasing investment in prevention to 5% at least of the overall health budget. We really welcome the idea of having a mechanism to independently advise on what the best buys in prevention are. We welcomed its recognition on the need to shore up the public health workforce and make it sustainable. And we need workforce development in that area. I mean, the pandemic certainly highlighted that to us. And importantly, we also recognised, and we pressed hard for this through our participation in the Expert Steering Committee, that we need a consumer and community engagement strategy to underpin prevention action in this country, with its practical focus being on supporting people to better self-manage their own health and to take action to be healthy. The blueprint for action that the strategy talks about will be the critical piece. What's going to be given priority and what's going to be implemented is really the important question now that we have the strategy. As a priority, we'd like to see overweight and obesity tackled in the same comprehensive way that we've seen tobacco control and smoking cessation tackled in this country. On telehealth, Medicare subsidisation for telehealth has been a long time coming. The pandemic was a catalyst for that. So to have it subsidised on a permanent basis through Medicare is fantastic. We know from our research that people valued it, people wanted it, doctors valued it and wanted it. But again, to the long game point, it's one measure. It's just over $100 million. We see it as a down payment on the 10-year primary healthcare plan. So what we are really waiting on is the government's release of its 10-year primary healthcare plan. That's been 2 years in consultation. Primary healthcare is the engine room of our health system, and it needs serious investment and its own long-term plan, in the same way that prevention has now its own long-term plan.